NMN raises blood NAD+. That part is settled science. A 2024 meta-analysis across randomized controlled trials found a pooled effect size of SMD 1.79. That's a strong signal. The supplement does exactly what it says on the label, biochemically speaking. So why don't I take it? Because raising a biomarker and changing your health are two completely different things. Most human trials in this space are small, short, and funded by the companies selling the product. When you strip out the blood markers and look for actual clinical outcomes, strength, aerobic capacity, metabolic function, the picture gets a lot less clean. I'm not anti-NMN. I'm anti-premature certainty. So let's look at what the data actually says, starting with why the biochemistry sounds better than it is. Here's what the research does support. Oral NMN, at doses between 250 and 900 milligrams per day, consistently increases NAD+ in blood across 12 or more randomized controlled trials. That's a real finding, replicated across different labs and populations. The supplement works as a NAD+ precursor. Nobody serious disputes that. The problem starts when you ask where that NAD+ actually goes. One of the most cited human trials enrolled prediabetic overweight women and gave them 250 milligrams per day for 10 weeks. Muscle insulin sensitivity improved. Muscle insulin signaling improved. Rigorous methodology, hyperinsulinemic euglycemic clamp, not a self-report survey. Looks like a win. But when researchers measured NAD+ directly in the muscle tissue, it hadn't moved. The blood number went up. The tissue didn't follow. What improved metabolically in the muscle did so without a measurable increase in muscle NAD+ itself. That gap between blood and tissue is something the marketing materials don't mention. Now here's where exercise comes in, because this is central to why I personally don't supplement. Regular aerobic and resistance training upregulates NAD. That's the rate-limiting enzyme in the NAD+ salvage pathway. It's the enzyme your body uses to recycle NAD+ precursors back into usable NAD+. Training also preserves muscle NAD content as you age, and it delivers cardiometabolic, cognitive, and musculoskeletal benefits that NMN has never been head-to-head tested against in a controlled human trial. Exercise doesn't just raise a blood marker. It upgrades the machinery that processes NAD+ in the first place. Which brings us to the ceiling effect. Expert review of the NAD+ literature concludes that in healthy young individuals, NAD+ is already near optimal. Supplementation is designed to restore levels that have declined, not elevate them beyond your natural baseline. And in well-trained older athletes, measured NAD+ levels match those of young controls. If you're consistently active and metabolically healthy, there may be no meaningful deficit to correct. The trial data backs this up directly. In healthy middle-aged adults with good baseline fitness, 6 weeks of NAD+ precursor supplementation raised blood NAD+, and aerobic capacity and motor function didn't move at all. A sports medicine review put it plainly. NAD+ therapeutics don't improve skeletal muscle metabolism or athletic performance in people without an underlying deficiency. Then there's a set of findings that don't get discussed enough. Preclinical data, cell studies and animal models, shows NMN can enhance tumor proliferation in some cancer contexts. UV-induced skin cancer mice given chronic NMN showed higher tumor counts and increased Ki67 proliferation markers. Pancreatic cancer cells showed greater resistance to chemotherapy. These are not human trials, and they don't prove risk in healthy people. But the human trial data is too short and too small to rule it out. The longest published human study runs 24 weeks. The FDA has excluded NMN from dietary supplement classification entirely because it's currently under investigation as a drug. That's not a technicality. It reflects how incomplete the long-term picture actually is. That's the case against, but the data isn't uniformly negative. There are specific groups where the signal is real. So who does the data actually support taking this? The strongest human result in the entire NMN literature is the pre-diabetic women trial. Postmenopausal, overweight, metabolic dysfunction already present. At 250 milligrams per day for 10 weeks, insulin-stimulated glucose disposal increased significantly versus placebo. Muscle insulin signaling, measured via AKT and mTOR phosphorylation, moved in the right direction. The methodology here was a hyperinsulinemic euglycemic clamp, which is the gold standard for measuring insulin sensitivity. That's not a surrogate marker or a self-reported outcome. That's a meaningful clinical finding in a population with a clear underlying deficit. The sedentary older adult data also holds up reasonably well. In a dose-ranging trial, 300 to 900 milligrams per day for 60 days produced statistically larger gains in 6-minute walk distance versus placebo, with the strongest effects at 600 to 900 milligrams. A separate 12-week RCT at 250 milligrams per day in older adults found maintained walking speed and improved sleep quality. These aren't dramatic transformations, but they're real, placebo-controlled improvements in functional outcomes that matter for that population. Dose matters here in a way that often gets flattened in the marketing. Blood NAD plus peaks at 600 to 900 milligrams per day in the best designed trials. Below 300 milligrams, the clinical signal weakens considerably. Above 900 milligrams, no additional functional benefit has been documented. So if someone in the right profile decides to try this, the evidence doesn't support a low-dose approach and calling it done. When you look at every positive trial together, a responder profile emerges. Over 40, metabolic dysfunction present, prediabetes, overweight or documented low baseline NAD+, sedentary or limited exercise capacity. That's who was enrolled in the trials that found real results. The supplement was essentially correcting a deficit that had already developed. The non-responder profile is just as clear from the ceiling effect data. Under 45, metabolically healthy, consistently training. If that describes you, the current evidence gives you no strong reason to spend $80 to $150 a month on this. Your NAD plus machinery is likely already running close to capacity, and the trials that enrolled people like you found no meaningful clinical benefit. The practical framework I use is exercise first, always. Aerobic training plus resistance work addresses NAD plus decline at the enzymatic level, builds the infrastructure that processes it, and delivers benefits across every system NMN has been tested on. Usually with larger effect sizes and decades of clinical outcome data behind them, NMN as an adjunct only makes sense once that foundation is already in place, and only if you genuinely fall into the responder profile. On risk, short-term safety up to 900 milligrams per day looks clean across trials. No serious adverse events, no clinically meaningful changes in liver function, kidneys, or blood markers within the duration studied. But the unknowns are real. Long-term cancer risk is unresolved. The SASP amplification data from preclinical models hasn't been addressed in any human trial long enough to matter. If you have existing cancer, are currently on chemotherapy, or carry a high cancer risk profile, the preclinical flags are serious enough that waiting for human data is the only defensible position. The FDA didn't exclude NMN from supplement classification arbitrarily. That decision reflects the same gap in the long-term evidence that I'm describing here. NMN isn't a scam. It's a legitimate NAD plus booster with a narrow, evidence-defined use case that most people watching this don't fit. NMN works biochemically. But for most healthy active people under 45, the evidence doesn't justify the cost or the unknowns. If you want to see how exercise stacks up against the full supplement category on NAD plus outcomes, that comparison is the next video. Subscribe if you want the data without the sales pitch.